Okay, let's go. Gary, what's on the agenda today?
Yes, commissioners, today is, wow, Tuesday, June 30th, the last day of the fiscal year. We have several issue items for you today, but we'll start with roll call. Chair Bernard,
Here?
Commissioner Fisher,
Here.
Commissioner Savas,
Here.
Commissioner Humberston,
Here.
and Commissioner Schrader is online but having trouble with audio. So as soon as she's able, she's here though. So we'll start with a coronavirus update from Nancy Bush, Director of Disaster Management and Incident Commander of our Emergency Operations Center.
Okay, thank you. And Dorinda, I think you'll need to bring in Philip for me. So I will have Philip Mason Joyner with me here today too, and he's going to talk a little bit more in depth about public health and what they're doing, but I'll start with our basic update. So for our numbers today, Oregon has 8,485 positives. There's 204 deaths, 226 and 648 negatives. Clackamas County has 716 positives, and that is up 51 from last Friday. There are 24 deaths, 21,914 negatives. Multnomah County has 2,167 positives, and that is up 139. 69 deaths, which is up 1, and 48,638 negatives. Washington County has 1,315 positives, which is up 101 from last Friday. 20 deaths, 30,766 negatives. Our hospitalizations for the entire state is now 108, and those are COVID positives that are confirmed. And that is up 19 since last Thursday. So we're starting to see a rise there in our hospitalizations as well. Some things we have going on here in the EOC, we're starting to work on our action report so we know where to improve our operations in the future. We have someone that is actually doing interviews with a set of questions. And so it's always important for us to take a look at what we're doing and making sure that we can improve on what we're doing in the near future, as well as other activations that we may have. We are working to get additional PPE out to our community-based organizations so that they can get PPE out to our vulnerable populations here in the county. The state is currently providing direct shipment of PPE to our long-term care facilities, which of course relieves the county and the EOC from having to do that. The business assistant grant is open and the applications are accepted through July 3rd. We heard this morning that there's been a lot of questions about that and a lot of activity around that particular grant assistance. We are also working on recovery planning and what that may look like and what that will look like for the county. And we are doing some, having regional conversations around that as well. And the commissioners will be hearing more from us in the very near future about our suggestions for that. So that's all I have today, but I do have Philip Mason Joyner with us, and Philip is going to talk a little bit more about the public health response and a little bit more detail there. We know that our numbers went up for statewide over the weekend, and we just want to address a few of those. So Philip?
Thanks, Nancy, and thanks, commissioners. So as of right now, I know there's a lot of interest about our staffing to do the contact tracing and disease investigation work. We currently have 37 FTE and 52 individuals that are doing this work for us. So we've gone from a team of 7 staff to now 52 people to rapidly get them trained and get them doing this work for the community to help with this response. We do have a new batch of staff we are planning to train next week because with temporary employees, not all of them are able to commit long term. So we're gonna have some natural turnover that's going to happen as we move forward, and to need to increase our bilingual staffing that are available to make sure that we really have a focus on quality improvement. That as you add more people, it becomes quite complicated to assure that we're being consistent and standardized in our approach. And to make sure that training and that the processes are really going well. We've transitioned to the new state database that is now available and worked through those kinks, and just all the technology it takes to have a lot of these folks working remotely and building this as we go. The state expects that we have at least a plan in place to have 63 of these contact tracers available. And I know that there's a lot of confusion. We're keeping up with the cases. We're following up. We're meeting those metrics of what we can control for this work. I feel very confident that our public health team has a really good plan in place to meet the needs and the capacity. I think one of the challenges we're going to have ongoing is just the skilled staff to lead outbreaks. So during a fall or winter where we have flu or norovirus happening in the community, we usually have 1 or 2 outbreaks happening at a time. Right now we have about 15 happening at any given time. And to have that leadership to just guide those processes and to work and provide the consultation for these employers and these long-term care facilities, it is a lot of effort, and we need the community's help to slow the spread of the disease by wearing their face coverings when they go out in the public. And also, I think one of the key messages that we are working with our PIOs to lift is to continue to let folks know that the transmission's happening, the spread is occurring across the community, and that folks really, when they go out, they really do need to continue to focus on going out when it's really essential, when it's needed. Keep your gathering small, and that, you know, face coverings are a helpful tool. They're not the only solution. We still need, the best way is to limit our contact and exposure when we're out in the community. We also, just very briefly, I know there's a lot of interest in testing. We now have a contract with OHSU and Lake Oswego Fire where we can have them go out and increase our capacity. Rapid teams, they have bilingual staff that can go out and do the testing for us, and we help coordinate that with them. A lot of our testing is still focused on the healthcare system, private clinics, and we really are referring folks to work with their healthcare providers to get testing. Testing in the region, the capacity continues to increase every week. In June, we've seen, which is a very good thing. And I just lost the lights. And our clinics here at the county, they are doing testing. It's focused on serving their patients. And then we refer, if folks do not have a primary care provider, do not have access to healthcare, we're referring them to our county clinics, and that's the role that they're providing us. The other big lifts that public health is working on is school reopening plans. So I've assigned our public health emergency preparedness coordinator, Kirsten Ingersoll. She's dedicated full-time this summer to work with our school partners on the process to review for our county. We're anticipating 170 plans that will need to be reviewed. This is the public schools, this is the private schools, our community college and technical universities as well. So we are concerned about that, being able to do that quickly. They're due to us in August, all the plans. We're gonna need we're anticipating around 4 full-time staff for a couple months to review these plans, to provide feedback and consultations to our school partners and make sure that schools can open very quickly. I think that, you know, if we are able to be really intentional about engaging the community to help us with limiting gatherings and wearing face coverings, then we'll be more successful, that schools can open this fall, that parents can go back to work. And you know, that's one of the key messages that we're focused on right now in order to be able to move forward with schools reopening this fall. That's my high level update. There's a lot more I could talk about, but I think I'll stop there.
Thank you. Paul and then Ken.
Yeah, I appreciate all the work you all do. I was kind of hoping maybe that I would get a response back from my letter I sent to the governor with regard to some of the data, particularly. But that may not happen, I presume. But I did want to ask a question, Nancy, in your, the situation status report that you send out, and I guess over the weekend, is it always a 3-day spread, or is it a date? I mean, how often is that done?
So no. So the reason why I talk about over the weekend is because our last report was on Friday. And then the weekend happens, of course, we don't have reports, and then our report on Monday. So
Okay,
that we don't have new data for today, so it's from Friday to Monday.
okay. And the reason I ask is that, and I haven't studied all of them, but I did, you know, there's when numbers don't quite add up, it just jumps out of my head for whatever reason. I just have a thing with numbers. So as I looked on the numbers in that period, and I see on the SITSAT it says since 6/26, which was Friday, the number I got for Clackamas was correct, you know, at 51 cases, but Multnomah County's numbers were actually 172 in that same time frame, and Washington County was 112. So it's just a bigger spread, and not that much of a bigger spread, but I'm just kind of watching the numbers because I get that OHA report every day, and it gives me the daily numbers, and that includes Saturday and Sunday. So I get the individual day numbers. I'm actually running the numbers all the time. So I'm not only am I looking at the number, but I'm looking at the delta and the percentage between us and the other counties, most especially since the governor kind of tethered us all together. And but I just wanted to just kind of see if my numbers are right or they're not right, because I think sometimes it looks as though I'm looking at the 12:01 a.m. day, you know, 6:29, and then the 12:01 day as of yesterday, as of yesterday. Just kind of trying to sort that out.
Yeah, and it may be that, and I mean, I don't know unless I take a look, but it could be that you have more numbers from, yeah, I don't know. I would have to go look. I'm sorry, I don't know. I can't answer that without knowing exactly where we're getting our data.
Yeah, okay. And I was just want to make sure that if we are getting our data from either the OHA website or wherever we're getting that from, that tally, that the other counties are they getting the same data and so forth? And
they are, and we're getting ours from the OHA website, but it may be that your data may be a little bit later than mine, just because I haven't had time to update mine right now.
Okay.
It could be that. I don't. Yeah. But we use OHA.
Okay. Yeah, just wanted to just kind of point out that spread. And actually, you know, I'm actually going to factor Marion County in here from now on, because Marion County's numbers are pretty high as well, much higher than ours.
Okay.
All right, Ken, then Sonia.
A quick question, and I think you gave me an answer to this before, but I lost track of the answer. How many ICU beds do we have in the state?
If you give me a second to look that up, I can do that, unless Philip knows that off the top of his head, which I don't think he does.
What? All right, well, she's looking up. Go ahead. Yeah,
I was going to say, and while that's happening, the 108 that are hospitalized, are they all in ICU beds, or do we know the answer to that?
I don't know the answer to that.
Okay.
Yeah, because there's thousands of beds, but how many ICU beds? And if we
Yeah.
don't know if they're in ICU, then that figure doesn't matter.
Yeah, and again, with the idea that we wanted to make sure that the ICU beds don't get overloaded, because that's where people that are in desperate need get treated.
Yeah. So there's a total of 767 that are staffed in the state, and there's 207 available. But I don't know. Yeah, I don't know how many of those hospitalized with COVID are in ICU beds.
Okay. Thank you.
All right, Sonia.
Yeah, so I'm curious, I think most of us participated in the town hall yesterday that AOC put on with the Black, Indigenous, People of Color group. And one of the topics of conversation was around the state, how OHA has guidance that people of color should be able to receive a test upon request, but that wasn't really being translated to the action on the ground of access. And so I'm just wondering, Philip mentioned some mobile things that we're doing, and we have bilingual staff. I'm just wondering how we are doing in Clackamas County on that issue. Yeah, that's my question. Did that make sense?
Hey, Philip, I'll let you take that.
Thanks, Philip.
So I know Multnomah County is doing test events for priority populations, including Black and Indigenous people of color. We have not stood up those types of event in Clackamas. That's something that we could discuss. You know, our teams that go out, it's really focused on when there's been an outbreak at a congregate setting. So it could be a housing complex where we've got folks with underlying health conditions. It could be a long-term care facility, or it could be a workplace. You know, just with our capacity, with our funding, the focus has been really on having to be reactive. And, you know, I think it takes more resources in order to be able to do those proactive campaigns. We've been effective at partnering with the healthcare system, referring folks to those regions. You know, we see testing as a regional resource, just like our hospital systems are, just like our clinics are, and trying to connect folks. You know, if folks feel that they need to get tested, we certainly want to support that. But we are fairly limited at what we in the health department can do to provide directly.
All right. Martha.
Microphone.
Was having technical difficulty here. I could hear you from the beginning, but my other iPad would not allow me to join the video. So Nancy, this was kind of, remember I tried to, when we had strategy the other day, that was kind of what I was trying to get at, because Shashila from Multnomah County talked about how they were proactively reaching out to people of color. And we're doing that, but we're almost more, what I heard from Philip was we're more reactive than proactive with that. And it's probably has to do with resources. So is it also have to do with the fact that they are getting money? Multnomah has dollars directly from CARES and we don't. And so are they able to implement, you know, more of a proactive program because they have the resources to do so, whereas we're still under the under 500,000 rule with strings attached across the board. So I was trying to, because that's kind of what I asked yesterday, because that struck me too, that, you know, we're not, I didn't think we were doing exactly what they were doing.
So I can let Philip chime in here too. I mean, I don't know exactly, you know, what funding they're using to do that, but but yes, I mean, they obviously can do more because they do have CARES dollars and they have that available to them. And of course we don't, and which means they do have more resources than we do to do such outreach and to do, you know, that direct interaction with the people of color in their county. So Philip, do you have anything to add to that? But my initial reaction is yes, they absolutely can do more because they do have more resources.
Yeah, I don't have a whole lot to add. I agree. We do have a very active liaison section that has a team, a vulnerable populations team that's reaching out to community partners and hearing these concerns directly from the community. So I think we are being intentional about reaching out to folks to understand what their needs are and to advocate for those needs. Our liaison team is also having weekly calls with their counterparts at Multnomah and Washington and OHA, which is very helpful to talk about how we can share some of the resources. Because at this point, we just don't have the capacity to be able to do everything we would like to do.
For example, since we have a large Hispanic community in our rural areas, there hasn't been any proactive outreach for testing. That's really from our perspective. So sorry, they keep barking.
Well, considering the fact that,
what I would suggest, Jim, is that you need to tell the governor that they have, and as far as I'm concerned, they are actively setting up structural barriers to people of color with not allowing us to have the dollars we need to do the work we do. I think that needs to be a strong message because this is the big thing right now and our people are being discriminated against, in my opinion. And I think that needs to be out there. Really?
Well, this afternoon, I'll be speaking to the governor. Matter of fact, during our afternoon policy session, and that's a good point, Martha. I want to add also that even though we have good. We filed an application for our money to be returned. We don't have an IGA yet that is reasonable. So Stephen is working on that, and evidently he's talked to the folks, and they're going to take a deeper look at some of those restrictions, but he might be able to refer to that.
Yes, correct, Chair. We had a call. We wrote the letter on behalf of the Oregon County Council Association last week. We got a call yesterday from the Department of Justice saying that they're willing to revisit some of the conditions that they imposed on that grant funding agreement. And we haven't heard anything formally back from them since then, but hopefully we'll get some movement later today or later this week.
All right, Paul, let's finish.
Yeah, I just want to build on what Commissioner Schrader was speaking about as far as that call yesterday with the BIPOC. And it's very clear that Yamhill County and Marion County, being as intensively farming counties as they are, and we are as well, that they are certainly seem to be doing a pretty outstanding job of reaching out to the farm working community and others that are that need, while we had to have our tracers have those bilingual skills to be able to communicate with them. So I thought that was pretty significant as far as their level of outreach. And I don't know if we are doing the same. You know, we were not one of the 4 counties that was presenting there yesterday, but I thought it was very informative. Kind of in a way, it's actually kind of encouraging, you know, as far as their efforts. So I think they're taking a lead, and I don't know how the other counties fare in that regard, but I'd be interested to know how we are doing in that across the state.
Well, and I did put a call into Barb Iverson because a lot of them are working with the Oregon Farm Bureau on that, and I don't think we've made contact with them directly yet, giving it's an ag, so that might be something we consider.
Yeah, and it's just not the farm working community. It's also some of the, you know, working in the stores or trucking. There's just a lot of areas where we need to make sure we have those skill sets to communicate or not have the fear. I mean, literally, maybe they speak both languages, but actually having a person of color reach out to them as a contract tracer opens doors that otherwise would be closed.
All right. Thank you, Nancy. Thank you, Philip. Have a great day.
All right, thank you.
Get some rest.
Nancy, stick around, please. All right, I have a few COVID updates for you. First, commissioners, I'm going to seek your approval to ratify a contract I signed on your behalf yesterday for Do Good Multnomah. I emailed you about it. It is amendment number 2 to Do Good Multnomah to administer a motel voucher program. The cost is $22,500. Funding comes from the CARES Act, no general funds. So I signed this on your behalf because it needed to be done yesterday before the end of the fiscal year. So I'm seeking your approval or your ratification of that contract I signed on your behalf under the COVID-19 emergency declaration.
Move to approve.
I'll second that. Any further discussion? Sonia?
Gary, so I'm just curious. Oh, wait, forget it. I don't have a question on this. I have a question on something else. Sorry.
That's the next one. That's coming up next, Commissioner.
All right. So there's been a motion and a second. Brenda, will you poll us?
Yes, thank you. Commissioner Savas?
Aye.
Commissioner Humberston?
Aye.
Commissioner Fisher?
Aye.
Commissioner Schrader?
Aye.
Chair Bernard?
Aye. We didn't really have to vote on this. Gary can make that decision for that amount, certainly. He just was informing us.
Well, because it's an intergovernmental agreement, only the commissioners can approve intergovernmental agreement
Okay.
over $5,000. So you do need that permission. But thank you.
They're a government?
Intergovernmental agreement. Yes. All right. So next, this is what I did not approve this. This one is waiting for your approval today. I'm sorry for the short notice, but it has to be approved today, and you don't have a business meeting this week. So this is an intergovernmental agreement between Clackamas County and Washington County for a respite isolation shelter which is required under the governor's phase 1 reopening approval. The amount is for $305,325. This does come entirely from the general fund. However, we plan to submit a reimbursement to the state for CARES Act funding, and we expect to be reimbursed, but of course that is not guaranteed. Commissioner Fisher did have a question, how many beds does this cover? And Nancy, could you answer that, please?
Yeah, so this covers 15 beds with an option to expand to 20. And I also want to talk a little bit about the services, because it's not just the room. We are still getting single occupancy or double, depending on if it's for a family or a couple. It also up to the shelter for 14 days for those clients. Provides meals 3 times a day. It also provides emergency medical technicians to provide wellness checks 2 times per day for those that are positive. And then also will work with us and call us if their transportation is needed for any of our clients from Clackamas County that are wishing to leave the respite center. So it's not just the rooms, it includes all of those things as well.
All right, I had Paul and Sonia.
So you may recall about a month ago, I mentioned, or 2 months ago, I mentioned I was listening in on a federal call as far as the CARES Act funding and the COVID funding and a lot of questions. It was a national call. And in that national call, they were talking about what's eligible, what's not eligible. So my question is this, if we don't use those beds,
So
do
yeah,
we still incur the cost?
Yes, we still get, yes, we do.
Okay.
Washington County is doing that as well as Multnomah County. And we would, yes, we get reimbursed for those costs because Washington County has the whole facility. They're
Yeah.
paying.
So the reason that concerns me is that on this federal call, it was very clear. People were saying, well, what if you are just housing people because they're, whether they're homeless or they don't have a place, but they don't have COVID? Response was, it's not eligible.
So this is for COVID patients only.
Right, but if they're not used,
It's still eligible. I mean, I know Washington County is using their money for this, so.
Yeah. I just hope that we don't end up not being eligible for that if we don't use it.
Well, and I mean, I can't, to being transparent, we run the risk. I mean, because we're going to be turning this into the state because we don't have our own CARES dollars. We are running the risk, but we do have to have it for phase 1.
I would bill them as soon as possible because she said they had 150 million. Once that's gone, what do we do?
Yeah.
All right, so Sonia, then Ken.
Oh, Nancy, I'm really curious. So you said Washington County has the site. Did they purchase it?
No, I don't know if they're leasing it, but no, they haven't purchased it.
Okay, because there's a lot of conversations going on, which I hope that we have the lens, this certain lens of trying to use our COVID dollars as leverage for other dollars to actually purchase some of these hotel motels so that we can use them afterwards, so that our dollars just aren't, used up for COVID and then they're gone, but to use them as a way to leverage other dollars. Lots of conversations through AOC, and there's a project called the Turnkey Project. So if we could just keep that in mind as we're moving forward, so the dollars can last longer, we can kind of look at it as building the recovery we want afterwards, and then repurpose these facilities for transitional housing when COVID, after we have a treatment or a vaccine.
Yeah, so we have had some of this discussions internally too, and with some of the other money that we've been seeing. However, for what we might be able to find at this point would take a lot of work to get it ready to, anyway, we are talking about that, but there's also a lot of other money would have to go into it besides just the purchase.
All right, so Ken.
Thank you. Yeah, you can purchase something, but then operational costs are a whole other ballgame, and the funding for the operational costs become critical. My question was, did I understand correctly that this center that we're partnering with Washington County was mandated by the governor's office that we had to set one of these up?
So, yeah, I mean, it's part of phase one, and we were red on that check mark, if you remember.
Right.
As part of phase one, and we do have, Collins is one of the places that we have been using,
Yeah.
But it is very limited. And so we still needed a facility to do that. We did look at several places here in the county, and then Washington County approached us with this agreement and with, you know, the collaboration.
But this was definitely mandated out of the governor's office on OHA, correct?
It's part of phase one.
Okay,
Yes.
which strengthens our hand in terms of applying for reimbursement.
Yes.
Thank you.
Mhm.
All right. Thank you. Oh, we need to vote.
Mhm.
Move to
Yes, so
approve.
is there a
Second.
move to approve? And if moved and seconded, any further discussion? All right, Brenda, pull us.
Okay, Commissioner Fisher,
Aye.
Commissioner Savis,
Aye.
Commissioner Humberston,
Aye.
Commissioner Schrader,
Aye.
and Chair Bernard.
Aye, motion carries unanimously. Thank you very much. Thank you. Can Nancy leave now?
No, not yet. Thank you. So commissioners, as you know, last Monday, June 22nd, we opened the Development Services Building and Public Services Building to the public on a limited basis with reduced hours, Monday through Thursday, 9 a.m. to 2 p.m. I'm pleased to report that everything went incredibly smoothly. Our employees, as always, did a fantastic job. They maintained social distance, wore masks, kept our buildings safe and clean for our employees and the public. As of last Wednesday, the governor's order of masks went into effect, so we asked the public to wear masks in our building as well. In the Public Services Building, we had a total of 32 members of the public who visited last week. And in the Development Services Building, a total of 217 members of the public who visited last week. Primarily, they visited transportation and development, permits and engineering, and the assessor and taxation, the assessor's office, assessor and taxation office. So a total of 249 members of the public came to our buildings last week. There was only one instance where someone, a member of the public, did not feel comfortable signing in, which we are requiring members of the public just to leave their name, phone, or email. That's all. So that should there be an outbreak at the county, we could trace that person and let them know. Only one person refused to do that, and they respectfully said no, and they chose to leave because that is a requirement. We need to do that tracing, which is required. But it went very, very smoothly. So I just want to give that update to you. At our county, I was going to allow a few more departments to open as of Monday, but I'm going to temporarily hold on that. One, because I need to see their plans, which are still in progress, but also I just want to hold another week. So I'm going to make that decision, commissioners. We are still open for the public as we have been the last 3 months. So members of the public are encouraged to go online and email or call or check online what is open, what is not. And I'm confident we are providing services to the public, even though we are still remote. And if I hear otherwise or you hear otherwise, please tell me that. But with that, I just want to give you that update of our buildings and how we are still serving the public. And will remain the limited departments that are open. Those will still stay open next week. But I'm going to pause on more departments opening just for at least another week at a minimum. And I see we have some questions.
So Sonia.
Yeah, thanks, Gary, for that update. I'm just curious. I know that we talked about requiring masks of employees that couldn't socially distance before the governor ordered Clackamas County to wear masks. Do employees, if they're at their work space and they can be 6 feet away from another person, do they still have to wear their mask the whole time they're working?
No, they do not. Okay. Only when they can't maintain the distance.
Okay.
All right.
All right.
And then my final thing is, Chair Bernard, you wanted to update the board on public service announcements about masks, if you'd like to do that now.
Yeah, so I sent the governor a text the other day. Please don't close down, roll back our businesses and stuff. Clackamas County's doing a great job. And she responded back, please tell the citizens to wear their masks. So my idea was that each of us do a few second public service announcement, why you should wear your mask, and, pick a subject like, so our business community can stay open and move into phase 2. The economic, the health reasons, the family and friends reasons. So my suggestion is that all 5 of us do a quick public announcement separately that we'd probably film on Zoom. So I told her I'd help, and the county's helping. And so that's what I would like to do. And we have Paul.
So on that note, but I want to go back just a little bit to Sonia's question to Gary. I think that question was, if our employees can maintain 6 feet apart, are they required to wear a mask? And the answer was no, they don't. And yet the governor's order says everyone shall wear a mask indoors. So how do we reconcile that? It seems to me there's a difference. And if we're going to be messaging with Jim's suggestion that everyone wear a mask, and we're not following the rules internally, it seems I'm just struggling with that one. If we're going to be doing something and we're going to be abiding by a policy, then that means everyone should abide by the policy. So how does that not allow a person to walk into a store and say, hey, I'm maintaining 6 feet apart, so I don't need to wear a mask? And yet the governor's order is wear a mask indoors.
Gary, do you want me to answer that?
Yes, please.
Okay, so actually what the governor is saying is in public spaces. It is not saying indoors. So it's public spaces. So anyone that is coming in that would get services, for example, in our buildings, that is a public space. When we are in our offices, as long as we are not working with the public, that is our work office. It is not considered a public space. So public spaces are grocery stores, and she lists several things there. Grocery stores, restaurants, and those types of things. Because I mean, I've even, people are even wearing them when they're not eating and those types of things. But it's a public space. It is not the office space necessarily.
Okay, so public space would be outdoors as well, right?
If you can't keep 6 feet,
If you can't keep 6 feet, that is correct.
Yeah, I'll have to find the messaging that I saw, but the way that I interpreted the messaging I saw on the state website was those spaces that were indoors, and outdoors was excluded.
So
in her new order as of last week.
Okay, I'll go take a look, but I'm pretty sure it was public spaces, so I'll take a look.
Yeah, she doesn't distinguish indoors, outdoors.
No, I didn't think so either.
Anyway, all right, so Ken?
Yeah, I've been going to the farmers markets locally, and all of the farmers markets are requiring masks. Most people there are wearing their masks, and I wear mine, and realistically, that's the way you should do it, because you can't really say that you're going to be able to stay 6 feet apart from people when you're walking through a farmer's market where there's a lot of folks. So, I mean, to a certain degree, common sense prevails here. If you're going up the stairwell in our office buildings, the same rules would apply. You know that if somebody comes down those stairs, not going to be able to maintain 6 feet, so wear your mask.
Mm-hmm.
It's pretty simple.
So, and actually what I'm seeing on the website, it says for public spaces.
Yeah, and the farmers markets are clearly public spaces. So.
Yeah.
She didn't distinguish indoor, outdoor.
No.
All right, now can Nancy leave?
That is it. So unless there are any more questions for me or Nancy about COVID-related topics, then we'll move on. But any final questions? Okay, Nancy, thank you so much.
All right, thank you.
Thanks.
All right, so moving on, I'll ask Brenda to give an update on the Budget Committee and the applicant interviews for the Budget Committee openings.
Yes, thank you. We have 2 members of the Budget Committee whose terms expire today, Wilda Parks and Sean Caldwell. The Finance Department did a recruitment, and the recruitment closes tonight. So far, we have 9 new applicants, and both Wilda and Sean have applied for reappointment. So we have a total of 11 applicants. Last year, you adopted and agreed to protocol that at least 2 members of the board would interview all new applicants. So Our hope is today to identify which two of you or more want to do the interviews. We'll need to hold the interviews next week because the goal is to appoint the new members or reappoint the members, whichever you decide, on the 14th so that they are ready to meet at your first monthly budget meeting on July 21st. So my question today, I have two questions. Which commissioners and do you want finance staff Elizabeth Comfort to participate with you in those interviews?
I'm willing to do it, and yes, with respect to Ms. Comfort.
Paul, you have your hand up?
Yeah, so yeah, I would as well. However, I want to just add something. I think that it might be a good idea that we ask one question of all the applicants and those that are on the budget committee today, and that is, are they willing to, number one, do the extra work from all these extra meetings we're going to be having, and number two, more importantly, is that are they willing and prepared to make the necessary, to help us make the necessary cuts to the budget in order to balance it. That's our goal. And it seems maybe that, I'm not picking on anyone in particular at all, but it seems that overall, the last 3 years, there's been a reluctance to, number one, either recognize that there's a budget deficit of sorts, in the sense we can't get a balanced, sustainably, structurally balanced budget, and also a reluctance to make the cuts. That's a reality. So I just want to make sure that everyone's comfortable with that, with making those steps. It seems to be that has been, no one has, of the budget committee, has jumped out other than myself to say, let's roll up our sleeves and make this a structurally sound budget.
All right, so Paul and Ken are gonna do the interviews. You guys good with that? All right.
Perfect.
Are you okay with that one question, basically a basic question? I don't have the verbiage.
That was two.
Yeah. Number one, are you willing to take the extra time? And number two, willing to make the cuts necessary?
Well, yeah, so I don't think the questions need to be determined by the group. I've got heads nodding. Ask the questions you want to ask to pick the person you think would do the best job.
Well,
All right.
it'd just be more effective if that came from the board. That's why I'm putting it out there.
All right, so you two are doing the interview. I don't hear a rush of people telling you what questions to ask. So if you don't want to be part of the questioning, I'd be happy to do it.
I'm okay delegating this. Other commissioners. All right.
All right, go ahead. All right, you guys are doing the questioning.
Okay, so Kimberly will be setting up those interviews with Paul and Ken. Thank you.
All right,
All
next, advisory board and commission appointments. Brenda, please go
Yes.
ahead.
We have one today, the Community Health Council, and the Community Health Council voted unanimously to reappoint Tom Lorenz to his second term.
So moved.
Second.
Okay, it's been moved and second to appoint Tom Lyons to the Community Health Council.
Tom Lorenz.
Okay. Any further discussion? All right, please poll us, Brenda.
Okay, Commissioner Fisher,
Aye.
Commissioner Humberston,
Aye.
Commissioner Savas,
Aye.
Chair Bernard.
Aye, motion carries unanimously.
I think I forgot Commissioner Schrader.
Aye. Something different. It's okay.
Unanimous.
Your turn, Martha, your turn.
Whatever.
All right, Gary?
Okay, moving on.
Whatever.
Commissioner Schrader asked to add a topic, union president's meeting attendance by commissioners.
Yeah, I would like to attend the union meetings. So either if 3 of us want to go, it's a quorum, announce it, or if I could just go to approve them, I'd really appreciate it.
All right.
All right, the
Yeah, and
problem is,
I would like to also
Yeah, I think we
attend.
should.
I think that should be rotated, or we could all go, or, yeah. I agree with Commissioner Schrader.
Yeah, I think we should do a trade-off here because I know that you and Ken have been pretty diligent about it, but I'd like to check in with them once in a while too, just so I know what they're doing.
I
What?
certainly don't mind rotating it.
No.
Nobody else was doing it when I came on board and found out that you could do it, asked to do it, and started doing it.
Yeah, no, and you.
Actually, not true. I started it years
Well, I
ago.
meant, well, except for you. I meant of the other board members. My apologies there, Chair.
Yeah.
I figured you wouldn't mind. I wasn't worried.
Yeah,
Let's rotate it.
I'm
So
going to
we'll-
continue to attend, so let's just
All
rotate between the rest of you, because until I leave, I'm still the chair, so I think.
Well, that's okay with me. I don't have a problem with that. But why don't we just all rotate through once in a while? That'd be good.
Okay.
Okay. All right.
Is there a
Paul,
problem?
go ahead.
I just want to just add, that I have made the same attempt here years back, prior to Commissioner Fisher and Humberson getting on the commission. So I'm all good. I would like to participate, and I do agree it ought to be rotated.
Yeah.
We'll do it.
No big deal.
All right. We're meeting once a week or every other week now, right, Gary?
Every 2 weeks, every other.
Every 2 weeks.
Okay. So
All right.
why don't we just take a name out of the hat?
Okay. All right. Sonia.
Yeah, I'm just wondering about if 3 commissioners went, could it be noticed, or is this not a meeting that's appropriate to be noticed?
Not appropriate to be noticed, so I'll ask that not more than 2 of you attend, please.
It's negotiations with employees, so it probably wouldn't be appropriate. All right. Next.
All right, finally is Commissioner Communications.
All right. Who'd like to start? We haven't done a lot of liaisoning, except AOC, I guess. So, Sonia, you want to start?
Yeah, I feel like we always do a lot of communicating during our meetings, but there's one issue that came up at I'm not sure when we had the policy session for the Housing Authority and the veterans vouchers, but it dawned on me that might be a role for the commission to play, given that if we could, work with our congressional delegation or work with Veterans Administration, we're not getting those referrals from the VA. And I had a quick chat with Jill Smith about it, and she was asking, we just talked about that there might be a role there. So I'm sure this is a priority for our commission. I'm not sure how we do it or what we do, but I want to just see if there's interest there and to ask Gary to follow up and allow some commissioners, whoever it is, to do whatever we can strategize as appropriate. We shouldn't leave those vouchers on the table, and we need to put some pressure on the VA.
Okay, great.
Does that sound good? Do we have?
Yeah.
Okay, just as long as we have support from the board, I think that will be enough.
Yeah, I would say all of us have interest in that. So, Paul, you want to go next?
Yeah, sure. 2 things. I just wanted to update. I found on the website where I read it, on the OHA website, and I'll do a screenshot and send this to Nancy, but I just want to tell you all what it says. Statewide mask, face shield, face covering guidance dated June 30th, 2020, as of today, even though this is material I saw before. 2 bullets: all businesses as defined below and to the general public when visiting these businesses. So that's the application of the policy. It's long. And then the second bullet: the general public when visiting indoor spaces open to the public.
Okay, they said general. Okay, general public.
The general public when visiting applies to the general public when visiting indoor spaces open to the public. And then it's got guidelines for whether you are a business or you're part of the business in indoor, outdoor. But it's long-winded, but it specifically has that sentence in there which says general public when visiting indoor, not general public when visiting outdoor. Okay, so I'll do a screenshot. Maybe I can direct you all to the page so you can read that. My update, Sonia, you and I were part of the join conversation, and so I thought that under issues we would talk about that today. So maybe you can jump in on this. So as Gary informed us last week, that there were 3 meetings. We found out there would be a 4th, and then maybe later in the summer another. Sonia and I participated. I actually engaged this time. Last time I was silent because we weren't really sure who's going to do what and when. I know that Ken had expressed interest in doing this, but this is kind of like something that is, I won't say taking a life, but it's something that's progress is being made at each meeting, some of which is designed for the legislature, some which is, I think, more suited for the city of Portland, and some of which, not that much of it, applies to the counties. So I think in order for us to actually represent the county, Sonia, I think we kind of felt that some of these things almost need a work session. So Brenda and Sonia and I debriefed yesterday, and I don't know what maybe Brenda might want to suggest or Sonia might want to suggest as far as a work session, but in order for us to actually prepare to indicate what the county's position is by July 10th, which is not this Friday, but next Friday, we need to meet before then.
Yeah, so I'll just chime in. Brenda's done a great job being part of staffing us at this joint meeting. There is a spreadsheet. I believe everyone has access to it. What I think that all of us could say, Paul, Brenda, and I, and even some of the commissioners from other counties, we're not quite sure what the asks actually are. And Brenda did a good conversation with Katrina to try to get clarity, and we have some clarity. And I believe that Brenda, maybe not, maybe we're waiting for direction from all of us, but to push out questions regarding some things such as fair housing. There is a request for working for restorative justice with our education community. There are other issues and ideas such as equity liaisons throughout departments, and that's something that I would suggest we do thoughtfully, if that's appropriate for Clackamas County when we have our EDI office up on board. But long story short, I think we do need a policy session, a time for us to get our staff expertise, educating us as an entire board sooner than later, and we may not have all the answers, but at least we can all be educated at the same time on this issue. So my suggestion would be that we do put this on for a good hour discussion and ask staff to just go down the spreadsheet and the list and fill in the what information we should know. Does that sound good?
Well, what's our schedule like, Gary?
We could do it next Tuesday, July 7th, in time for your July 10th meeting.
Let's do it.
Yep.
Put an hour aside.
Yes.
And Brenda's done a lot of really good background work already, so I think we're well positioned to at least delve into some level of depth on these.
All right, so next Tuesday it is.
Yeah, that's all I have.
All right, Ken?
Nothing this week.
All right, Martha? Wait, you're on mute.
Never know when those dogs are going to bark.
Okay.
I actually put a call into Barb Iverson because I wanted to get a sense of what the Farm Bureau was doing in our rural areas of our community. I know that the governor's dollars that she put there for housing and other needs for that community that she's been working, there we go, there's the bark or the howl, that they, stop. Okay, that basically they're working very closely with the Farm Bureau. So I think it might behoove us to kind of take a look at that. I know that I've been attending the regional meetings, you know, that Rihanna is our regional person on a regular basis. They conflict with our business meetings. So a lot of times Tracy and I have to go back and forth with that. And basically that's just meetings where we're bringing in the business community to find out what their metrics are, what their suggestions are, how are we going to move forward to make sure that the economy remains as whole as possible under the pandemic. And I'm sure I have other things, but that's about it off the top of my head. So, and AOC. AOC has been meeting. And after we're done here, if I have time, there will be a conversation about childcare in the county that is ongoing with Greater Portland Inc. and our Clackamas Workforce Partnership.
All right, so I will probably save mine for after I come back, after talking to the governor, because I might have some information. And I believe that is, it's at like 2 or something. So I'll have to look. So I'll save that for then. And I already told you I emailed her, texted her. All right, great. So that's it for this morning.
Oh, wait, Chair Bernard, I have a question.
Yes.
Sorry. So Martha, question on, I've been able to sort of moonlight on some of those regional solution calls to get information. They're excellent calls. For some reason, the link that I had the last week wasn't working, so I couldn't get on. But I want to know if it's okay, Gary, do we need to notice those meetings if more than one commissioner goes on them? They are probably the best information from all the calls I've been on. And they're very timely because they're Thursday mornings right before business meetings. So it really helps tee up if we have any questions for Nancy or Sarah present for the business meeting.
I think as long as there's not a quorum, I don't think it matters who joins if you want to get in and listen in. I happen to be the appointee on that group, but that's fine. I don't mind.
Yeah, I don't need to talk. I just want to listen. So I just want to put that out there, be transparent, and make sure I get the correct link somehow.
So I need Stephen's help. If any 3 of you are at a meeting, whether you speak or not, it's a quorum, and we have.
Quorum.
Is that right, Stephen?
Yes, that is correct.
Yeah.
Remaining silent does not affect the quorum requirements.
Thank you.
So your
Well,
policy advisors tell us.
there are other counties like Multnomah that have their 3 folks and they're not all speaking, but they're attending.
They have a separate lawyer advising them as well.
Do we know who that lawyer is? Do we have any influence?
So when I talked to Deborah about this issue, she said they don't talk about anything that they're discussing at the business meet or their meetings, and that was their reasoning. But anyway.
Well, that's sketchy. I'm sorry.
Yeah, I don't know who their lawyer is, but I'm going to trust ours.
That's, because they are going to be deliberating towards decisions. And I would be very careful with that because that could come back to bite the organization. And I think that, Sonia, you suggested that maybe that they notice this, but whether or not they want to, I don't know. But I won't go on unless it's noticed.
All right.
Well, Gary, can we notice the regional solutions meeting? I mean, who else wants to go on? Anybody else?
Well, Paul's waving, and I see your hand, but they were. Did you want to go?
No, not this. I was going to go back. I was going to ask Madcore a question. So, Stephen, yesterday, Martha and Sonia and I attended the town hall, the virtual town hall. None of us said anything. We just listened.
Yeah.
Did that need to be publicly noticed?
Yes.
I don't know what your town hall is, Paul. And these questions are better asked during an executive session, not in public sessions.
Well, I mean, I don't have anything to hide. We're trying to abide by the law.
I don't want hypotheticals from you, though. I don't want them on the fly. This is for your own protection, not mine. If you want to give me a specific request, I'd be happy to give it to you.
Mr. Administrator, could you help with this?
So actually, yes, your session yesterday was noticed. It's on your calendar, the AOC virtual meeting town hall. That was noticed because your staff knew that 3 of you at least were going to go. So we did notice it, even though you did not speak or have a major role there. So both your attorney and your administrator are advising you, if any 3 of you at least are at any meeting, period, you should notice it. It's your call if you choose not to, but that burden is on you then.
And there are exceptions. The law applies for conferences and association gatherings, site visits. There are specific statutory exceptions. But the general rule is if 3 of you are meeting on government business, then it should be noticed as a public meeting.
Well, sometimes we don't know if 3 of us are meeting because it's just on our calendar and we join. So
That's one of the
Now,
challenges. It's one of the challenges of Zoom right now is that you can kind of just join conversations. So that's something new we're going to have to really look at. As far as the regional solutions piece, as I said, I serve on the board, so which is one of the reasons I was asked to be on those. But like I said, as far as I understand, they're open to everybody. And I thought that our conversation with the legislators the other day was really more informational on their part. I actually had to jump off because we had a strategy session. And the issue I have with the regional solutions team is it conflicts with our business meeting. So oftentimes I have Tracy stay on if she can to continue to listen. So.
all right. Brenda, did you want to say something?
Yes, I was just going to say, generally, it's a general rule. On Thursdays, we look at each of your calendars for the fall, and put on the notice anything that we see on 3 of your calendars that is related to county business.
All right. That should answer everybody's questions. Anything
Okay.
else, Gary?
Yes, so for this afternoon, commissioners, I'm going to move your schedule around to accommodate Chair Bernard on this recently scheduled meeting with the governor. So my proposal is that we'll keep your 1:30 policy session as scheduled, and then we'll switch. We'll do the broadband grant next, then the small grants, and we'll end the day with the Metro Get Moving 2020 measure. So unless there's objections, that's the reschedule we'll do for this afternoon.
So Jim, what time are you going to be on the phone?
Well, I have to get my calendar up. I think
2:30 p.m. to 3 p.m. is your call with the governor.
it's short, half hour.
Yeah, it shouldn't be, I can't do any damage in half an hour. Don't worry.
I don't know about that.
All right.
Let that little Italian loose. There you go.
You're now done until 1:30 today then.
Okay.
Okay.
Thank you.
All right. Thanks, guys.